Hello everyone, my name is Scott Morton and I will be giving my presentation on the mental disorder called schizophrenia. So here I have two different definitions of schizophrenia, the first of which coming from Google Dictionary. It states that schizophrenia is a long-term mental disorder of a type involving a breakdown in the relation between thought, emotion, and behavior, leading to faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationships into fantasy and delusion, and a sense of mental fragmentation. Dictionary.com defines it as a severe mental disorder characterized by some but not necessarily all of the following features: emotional blunting, intellectual deterioration, social isolation, disorganized speech and behavior, delusions, and hallucinations. The symptoms of schizophrenia can be broken into three categories: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are thoughts or behaviors that are present in a person with a mental disorder but not present in someone without one. Negative symptoms are the opposite. They are symptoms that are not present in a person with a mental disorder, but present in someone without. Cognitive symptoms are symptoms related to a decrease in memory, speech, thinking, and judgment. The positive symptoms associated with schizophrenia are hallucinations, delusions, thought disorders, and movement disorders. Hallucinations are when someone hears, sees, or in any way perceives something that is not actually there. Delusions are strongly held beliefs that are contradicted by reality. Thought disorders are simply unusual ways of thinking, or thinking in a way that is different than a mentally healthy person. And movement disorders are characterized by agitated body movements. The negative symptoms of schizophrenia are the flat affect, which is when a person conveys no emotion through body language, facial expression, or tone. Other negative symptoms are reduced feelings of pleasure, difficulty beginning or sustaining activities, and reduced speaking. The cognitive symptoms of schizophrenia are difficulty understanding information and using it to make decisions, difficulty with focus and attention, and problems with working memory. I work as an EMT and I frequently talk to patients with schizophrenia, and what I have found is that these cognitive symptoms are caused by voices in the patient's head who distract them from their everyday tasks. Imagine you are trying to read a book or do homework and someone is constantly talking in your ear. It would be very hard to focus and understand complex information. The symptoms of schizophrenia occur gradually, and a person must be diagnosed by a psychiatrist. The psychiatrist must use a manual called the DSM-5 in order to diagnose anyone with any sort of mental illness. DSM-5 stands for Diagnostic and Statistic Manual of Mental Disorders No. 5, meaning it's the 5th edition. The way schizophrenia works is that a person with schizophrenia's brain communicates with itself in a faulty way. What is thought to be the cause of the symptoms of schizophrenia is an increased level of the neurotransmitters dopamine and glutamine. Dopamine is the chemical associated with the pleasure pathways in the brain as well as emotional responses. Glutamine's role is to regulate metabolic pathways in the brain as well as regulation of the production of certain amino acids. When these chemicals are elevated in a person's brain, schizophrenic symptoms can occur. Developmental problems in the brain at critical stages such as before birth or at puberty can contribute to schizophrenia. The causes of schizophrenia are both genetic and environmental. There have been some links to genetics and family history. The environmental factors that increase the risks of schizophrenia are associated with faulty brain formation that have resulted from viruses, malnutrition, and childbirth complications. The psychosocial factors can be associated with traumatic events in a person's life. And drug use cannot be directly the cause of schizophrenic symptoms, but if a person uses many drugs over time, it can alter brain function in a way that schizophrenia is produced. Approximately 1% of people have the disorder, which is slightly higher in America, and about 1.5 million people will be diagnosed this year. Males typically develop symptoms earlier than females. Males start showing signs from the ages of 16 to 25, while females peak once in the period of 25 to 30, then again at 40. Treatment of schizophrenia is done through the prescription of certain medications. Oftentimes, these medications will lower the levels of glutamine and dopamine in the brain. Also, psychoanalytic treatment such as talk therapy with a psychologist can help a person learn to cope with and control their symptoms. These are the works that I cited. Thank you for listening.